what do you say to the people that are the skeptics and there's this stigma around psychedelics?
I mean, there's all sorts of different challenges. There's people who just not educated about the medicines and don't realise how safe they are in controlled environments. So long as a person is getting the right dose and it's pure medicine and it's in the right setting with trained guides, clinicians, therapists, then absolutely it's extremely safe unless a person is not qualified to receive the treatment. So if you have a history of psychosis, your background and your family, if you have bipolar or some of the other cluster B mental illness diagnoses, you may not qualify to have these treatments. But for most other people, if they've tried other treatments as well and they're not getting well, so they might have tried antidepressants, antipsychotics, other psychiatric medications, heaps of talk therapy, psychotherapy and so on, and they're still not getting better, then they deserve a chance to get well. And we hear from people who've been struggling for decades, if not, their whole lives, to get better, and they've tried everything and they deserve a chance to have access to safe and effective medicines and treatments.
And when you say the safe and effective, like antipsychotics come with a host of side effects, what sort of side effects are you talking about from psychedelics?
Well, there's really no serious adverse side effects at all, and that's been shown through hundreds of trials around the world. Some are small and some are larger, but there's never been any serious adverse events that have come out of any of these trials, so long as patients are screened properly, and which they have been in the trials. And patients, of course, have to give informed consent, but often patients don't realise just how ineffective an antidepressant or an antipsychotic is going to be, because quite often doctors don't provide full disclosure on the benefits and risks of a particular medication. And this is essential. We all need to ask those questions. To anyone listening out there, anything. If you're going to put anything inside your body, do your due diligence. Read the research, ask around.
It's very interesting. We're very quick to judge a plant medicine, but so willing to just accept
traditional sort of
medicine.
Tablets and things, yeah.
And again, to your point, question everything, not just one thing over another.
I think we need to question everything.
That's the world we live in.
Well, that is strange. I mean, quite a lot of people, I think, have tended to put their clinicians or medical practitioners on a pedestal, and so whatever the doctor says is right. Most doctors go into medicine and psychology or psychiatry or whatever it is to get their patients well, and they truly care about their patients. And I really believe that.
But their tools are limited, aren't they?
Well, absolutely.
That's the problem. It's not actually the doctor.
Blunt instruments. By the end of this year, we'll have trained over 600 clinicians. And a lot of them say to us, we just don't have the tools in our toolbox to get our patients well. And most of them do acknowledge that. There's just a few that don't want to acknowledge that. Oh, no, it's fine, we're getting people. Well, they are getting some patients well, but we have to be honest about this. The remission rates for people with depression from existing treatments like antidepressants and psychotherapy is about 15%. And for people suffering with post-traumatic stress disorder, it's about 5 to 10% from existing treatments. With these therapies, there's a consistent 60 to 80% remission rates after just 2 to 3 medicinal doses with a short course of psychotherapy. And the psychiatrists who are currently administering these treatments in Australia, since we made history, they're telling us it's like a miracle.
And that's because what the traditional medical treatments aren't changing or rewiring. That's right. That's why. Is that what we're saying? So maybe that's a good thing we talk
the traditional
about.
Treatments, you take a pill forever in some cases or for a long time. That pill could have a lot of side effects that you may not be aware of. It will be probably hard to withdraw from. And you may just become so dependent on it, even though it may not be helping you a lot. People just become dependent on whatever it is. And even if it's a placebo, it's
still doing something.
Yeah. Right? And that's what happens, and people just get hooked on that. But it's amazing how many people are asking since we started the charity who are just desperately in need. They've tried everything under the sun and they just can't get well. And it's also shocking for their families, for their carers. They can't work as well as they might. They may not be able to hold stable relationships, have children and families. There's so many things that this causes. It can cause homelessness and unemployment, and of course in the worst cases can cause people to take their own lives. And we've seen, unfortunately, many examples of that since we started the charity, just because as fast as we have made change happen in this country, it's not fast enough for some people.
So how has that been, introducing this in Australia? I can imagine there's a lot of red tape. You've made history. Tell us.
Pretty early on when we set up the charity in 2019, within about the first year, we spoke with the Therapeutic Goods Administration, the TGA, and they encouraged us to put in a submission to reschedule psilocybin and MDMA from Schedule 9, which is prohibited substance, to Schedule 8 controlled medicine. So we did that, and it was knocked back at the first hurdle, and then we put in another submission at that interim stage, and then it was knocked back still, but they had to give their reasons as to why they knocked it back. And so then they gave us their reasons, and when we immediately created a new set of applications addressing all of their concerns, and it was knocked back again at the interim stage, but then in the final stage it was accepted on February the 3rd, 2023, which was a day I'll never forget.
Yeah, I bet.
Because on that day we found out that over 13,000 Australians had supported these submissions. Wow. Over 13,000 Australians, and about 98% of those were in support, including a lot of clinicians, researchers and consumers, and just generally interested people in the community who know that we have a huge mental health epidemic. 1 in 4, 1 in 5 Australians have a mental illness. 1 in 6 of us are on antidepressants. 1 in 4 adults over the age of 55 are on antidepressants. And 1 in 30 kids, in some as young as 4, are on psychiatric medications. We're not using our own resources, our own resilience. We're not feeling empowered to actually heal ourselves and start to really look inside and see what's actually going on in our subconscious. On that day, February the 3rd, my husband goes to me, "Oh my God, it's been approved." And I said, "Be serious." And he showed me and I just went, "What?" And we started dancing around our kitchen, and we were just so happy because so many people there had been so many obstacles. So we were thrilled. And then in early 2024, last year, psychiatrists started becoming authorised prescribers so that they can be the prescribers for these treatments. They have to have been trained. So we've trained over 100 psychiatrists so far. They work with other clinicians like psychologists, GPs, mental health nurses, social workers, counsellors, psychotherapists and others to administer these treatments, because there's always at least 2 therapists who sit with a patient during a medicine session through the right mindset, and then sit or lie down. Usually a patient would be lying down with an eye mask on, earphones on, listening to a very beautiful curated playlist. And I specialise in making these
amazing
playlists, and having this experience, which many of them will describe as one of the peak experiences in their lives. Since last year, there's been, I think, over 110 Australians who've received treatment so far. It may not sound like a lot, but it's becoming more and more as time goes on, because we're doing this slowly and steadily to make sure that it's all safe, sound, conservative, so that we make sure that the real world evidence that is collated is as solid as possible, and that patients are being treated in the safest environments with the most highly trained clinicians, so that their outcomes can be as satisfactory or as miraculous as possible.
So what is the criteria?
Well, at the moment you have to have treatment-resistant depression to receive psilocybin for depression, and you need to have post-traumatic stress disorder to receive MDMA assisted therapy. So you have to tick those boxes accurately. And, there's a lot of veterans and first responders, for example, who are suffering from severe post-traumatic stress disorder, and many of them are starting to get these treatments. You need to tick those boxes, and of course you need to give informed consent. I mean, there's not a lot of drawbacks. You just got to be a person who wants to actually undertake this treatment, which is an incredible treatment to undertake, because actually it'll be much more than just probably healing your mental illness. You'll probably get a whole lot of other benefits as well.
Absolutely.